Welcome to another episode of Let's Talk Small Data with T, where we are passionate about the power of small data in healthcare. I am your host, Tanazia Gonzalez, but you can call me T. Data has certainly changed the game in healthcare. Big data has blown the roof off, but small data, now that's the future. Small data allows us to dive deep into the key insights and take quick, customized action to achieve phenomenal results in performance and quality improvement. Let's explore this today. Thanks so much for joining us. If you have any questions for me or any of my guests, feel free to reach out to me at tgonzalez@eima-inc.com. Enjoy the show. Let's go. Welcome to another episode of Let's Talk Small Data with T, where we explore the power of small data in healthcare. Today, I'm excited to have Allan Morales join me for a talk on innovation and small data. Allan and I worked together in a previous life on some pretty exciting projects, and I'm really excited to hear about what he's up to today and what his insights are on innovation and small data. Allan is a project management professional. He's a data analyst. He's a business analyst. He's a Lean Six Sigma professional. He's got a couple of belts I'm really interested to hear about. And he's really passionate about developing and delivering solutions and insights for improvement, both on the clinical side as well as the performance side. His specialties are with reporting and analytics and insights. And I'm really excited to welcome Allan to Let's Talk Small Data with T. So if you can go ahead and turn on your camera so that we can see your face, that would be wonderful. Hello, I can see you. There you go.
Hey, T, how are you doing?
Mute. Hello, how are you?
I'm
So
doing great. Thank you. Thank you for having me.
yeah, thank you for coming on the show. I'm really excited to talk to you. And do you realize that it's almost 2 decades ago that we worked together
Oh,
on
wow.
the data projects? It's like a full lifetime for some folks. But yeah, it's been some time. So I'm so happy to see you on the show. And thanks again for joining me.
Yeah, thanks for having me.
Yeah, so we're excited about data. I know how passionate you are. I mean, you're just as passionate about it as I am, and designing tools and the buzzword innovation, right? And so today we're going to be focusing on that. So if you could just give us a couple of words, a couple of sentences about Allan Morales. Who are you? What are you passionate about? And where are you joining us from in the world?
Oh, I'm right now. I'm joining you from New Jersey. I live in New Jersey,
Okay,
town called Millburn, New Jersey. People
okay,
might know it by the mall that's near us, Short Hills Mall.
okay,
Um,
okay.
but yeah, it's a nice day out, beautiful day out, beautiful spring day.
Finally. Mm-hmm.
But yeah, basically, what I'm really passionate about is, finding opportunities to improve performance. It could be anywhere from, financial, operational, or patient safety. Really, patient safety has been the area that I've been working on the last couple of years.
Okay.
I was at Mount Sinai, and I really got into areas of quality improvement, patient safety when I was working with the QI group over at Mount Sinai, and then an opportunity came up to work for medical malpractice insurance company, and I
Huh.
decided to take it and pursue that. When
Okay.
been working with improving various
Mhm.
areas of patient safety and reducing risks for medical malpractice.
Okay, pretty interesting. So you have a lot of experience in the hospital space as well as in the malpractice space and insurance space, right?
Yeah, yeah,
Um,
really exciting stuff. So like in really tangible, experiences to really get connected
mhm.
to improving, how people get cared for. So
And I'm assuming that data is a big part of that, right? It's a
data is a huge part of it.
right.
It can come in many different forms, and
Hmm.
really it's a way of of driving change. You know, uh, an objective way of taking a look at how to best make improvements. And that's what we experience in healthcare.
Mhm.
Both you and I are, I think you probably mentioned, like, we're both from the healthcare background,
Mhm.
so we're both in the healthcare industry. So, and you know, the idea of continuous improvement is a huge part
Oh yeah,
of healthcare.
not just improvement, but continuous improvement,
Yeah,
right?
continuous is
Which,
like a big part of that.
yeah, no, totally. And I know that you need to have access to the actionable data, right? That will allow you to make sure that you're going around, going along the right lines, you're measuring the progress of your interventions and making sure you're going in the right direction. And you said another big buzzword, transformation. So that's a big one happening, especially as everyone's trying to get more on board with this value-based world that we're in now and really focusing on quality as opposed to quantity and really shifting folks out of going to the hospitals to really leveraging ambulatory care and primary care practices. So very exciting time in the industry right now.
Mhm.
Um, so in terms of innovation and small data, tell us, would you be able to give us a couple of examples of some tools or some projects that you've been involved in that kind of highlights and exemplifies, what innovation looks like with small data?
Yeah, when I think about that, I mean, for one thing, this podcast I see as being something that's really innovative. Just like
Okay,
being able to bring to a wider audience the idea of small
mhm.
data is innovative in itself.
Thank you.
So,
Yep. Yeah,
so I have to congratulate you
thank
on
you.
that
Thank you.
respect. So, but
Thank
when I think about innovation,
you.
typically I think about new technologies
Hmm.
and you know new processes or new new services. But it
Right.
doesn't necessarily have to be those things. I think that when I really boil down to what innovation means to me, I think it's more of a mindset.
Hmm.
And to apply that to small data, I think it really fits well with small data because
Hmm.
as a mindset, there are a couple key areas that are important to having an innovative mindset. Things like being open to change. In healthcare, we're constantly, it's a very regulated industry, so we're really,
Hmm.
facing change constantly. Whether it's from different new regulations or different federal or governmental administrations that have different agendas, and different focuses.
Right. Right.
So I think that's a major part of it, and we just have to be open to change. And I think being in healthcare, we're used to having a lot of change, and
Mhm.
that we're for the most part, we're we're open to it, and we're able to, you know, quickly. I believe from most of my encounters and from working in industries,
Mhm.
um, everyone's been really open to making various changes and adapting to
Right.
what comes next. I mean, how do you feel about that?
I mean, you hit on a couple of as they're talking, I'm going, because you're saying all of these buzzwords. I mean, with the podcast, I've been able to speak with a lot of different individuals, and they're all saying the same things, like mindset. That's one key word that I keep hearing. And I was just talking with a gentleman that I will be interviewing very soon on the podcast, and he's like, we need to be more open-minded, actually kind of opposite of what you were just saying. Yes, we are usually open to change, but my experience is that folks are usually more rigid and don't want to change anything because what's been working seems to be working for them, and they're like, no, 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 let's just keep it like this. Let's not go over there. And say, well, wait a minute, we might have an easier way to go and better improvement over here. Let's try it. Let's do a litmus test. Um, and, this gentleman was talking about it's time for a change of mindset. Let's address
Yeah,
it. People need to think differently, especially when you have access to data and it's time to use data and really building into your workflow,
yeah,
how you use data strategically, from sitting down with patients to prior to meeting with patients to after meeting with patients and just changing up how we do things on a regular basis. It reminds me of that book, Who Moved My Cheese? I always think of those two little mice. Have you heard of that book, Who Moved My Cheese? I
nah,
forget the author, but it's the book that they pull out when the change management teams come into play.
mhm,
And it's the little pictures of the two mice, and one mouse, they have to get through the maze to get the cheese. One mouse wants to try something new and the other one wants to just keep doing what he's been doing, which is not really working. And the other mouse who changes actually has more success. I think that is exactly what happens in the book, but that's the gist. But I always think of these two mice when I start talking to folks and they start talking about mindset. I was also talking with my cybersecurity group, which is going live at the end of May. They were talking about there needs to be a change in mindset in terms of how people are working with small data to help keep it secure. So that's a different, when we're talking about how they use it to move towards improvement. But I mean, yeah, so that's kind of what I've seen, folks haven't been as open to change as us data folks would like. And it can get frustrating, but that's what we're here to do. Help convince by showing.
yeah,
So when you say, okay, here's an example. Here's something you're struggling with. Here's something you need to track on a regular basis. Let me go ahead and put together this customized tool that uses these specific data points to give you these specific reports that can tell you how you're doing specifically on these outcomes, specific outcomes. I mean, and that's what I love about data is that small data is that you can go from the big picture, drill down and say, okay, specifically, I keep using that word purposefully. We're trying to get to this point. How exactly can we get there? And each path is very different. Therefore, you need to have very customized approaches, customized tools, customized, you said another word, systems, building systems. You need to have very specific systems, and usually data it's right at the center.
yeah.
Um,
And that's
so,
that's the that's the challenge, with healthcare. It's,
mhm,
as I said earlier, it's a very regulated industry.
mhm,
So, so you do have to have be able to be
pivot.
compliant
Mhm, mhm,
with the various regulations and
mhm,
operate within certain structural
right,
parameters.
right.
So I can see that how there's some resistance, but I
Mhm,
think the other part of it is, you have to embrace creativity and be able to change.
yes.
And like you said, like being able to think big and think about the big picture is
Mhm,
another part of it. So
mhm,
you want to be able to apply apply your approach to small data to make those big changes and think big and think of the bigger picture. I think
right.
that's really important, to
Mhm,
solving problems and improving performance and
mhm,
going that next step to continuously improve. I think that's
really.
being able to make those incremental changes,
Mhm,
will eventually, you know, like result
right.
in larger changes.
Yeah, yeah, that's another key words that you were saying, creativity, first of all. And when I hear the word creativity, I think vision. and so, you understand and be clear on your vision, but small incremental changes. I mean, that's at the center of improvement, right?
Mhm.
The continuous quality improvement and rapid tests of change, and the model for improvement from the IHI, I'm quoting from, Institute of Healthcare Improvement. As a quality improvement professional, I find that stuff really exciting. I mean,
Mhm.
just being able to know, okay, exactly what is it that you need to improve. So you look at the what, okay, and now you look at how. How are you going to tackle this? That takes you understanding who exactly is involved, like what's involved. Is it the providers? Is it the patients? What specifically? You get real clear on that, put together some metrics and understand, okay, I need to improve on this. And I know I'm doing a good job if I'm implementing this intervention, if my numbers look like this. I mean, and just having very specific tools to be able to track it at some regular interval. Um, I just find that really exciting. And that's what I love about small data. And then I keep using the term small data tools, which are usually, in my mind, these are tools that are like an Excel sheet or a database that you create for a specific intervention, not some big giant um, like AI tool or machine learning. All of that big data stuff certainly has a place, but so does small data. And small data really helps you to drill down to the individual patient. And really, the whole purpose of this is for us to improve lives, right? Yes, we have a lot of passion working with the data and being able to be creative and create things that actually um, give us great outcomes, but it's all about the lives that we're touching, which make it really fulfilling. Um, so, any other thoughts on like innovation and small data in healthcare that you
Yeah, so
want
I mean,
to?
you brought up the idea of value-based care earlier,
Mhm,
and
mhm,
I think that, this brings it back full circle to what you
mhm.
were just saying about the improving the individual lives and
Right.
individual care for individuals.
Mhm,
Like the idea of value-based care is really to people are using big data now to really get to develop uh, patient profiles.
mhm,
And
mhm.
what really boils down to is they're trying to get back to the individual, an individual approach
Mhm,
to providing value, providing targeted health interventions so
mhm.
that so individuals can lead healthier lives.
Yes.
So it all just comes back to the individual, whether or not it's small data or big data. I think
Mhm,
eventually, right now, what we consider as big data,
mhm,
the way things are exponentially growing in the data field,
mhm.
what we think considered as big data now might be considered small data 10 years from now.
Possibly.
So I
Yeah.
mean, so I think, like, ultimately, I like to think of, data as data. But as you get to uh as you try to focus in
Mhm.
on where you want to make your intervention or make your
Take action.
changes, that's
Mhm.
where you get to the small data,
Yes.
and you're able to really think and act faster,
Yes. That's what it's
by
about.
having that targeted approach.
Yes. Yeah. So like the small data, like you said, it's an action. It's more in action. We're diving in. Like in my intro, I said we're diving deep so that we could take action. It's about taking action so you can achieve a certain outcome. Um, and it's really it's powerful, especially as we move along in population health and deal with certain populations. Because each population, whether you're talking about the diabetics or you're talking about even like the elderly patients, that's one population I keep hearing about. I keep hearing about the diabetics. Of course, there is some overlap there, but we have the elderly, we have the pediatrics, and then we have women, and then we have I'm hearing about all of these different populations, and I'm getting really excited because well, I get excited when I talk about healthcare and population and serving folks by way of data and reporting and analysis, but um, it's just so much more we can do, and it's really exciting to hear all of the different things that people are doing with data all over the globe. I mean, I just spoke to someone in Nairobi, Kenya, and heard about what he's doing with predictive analytics. So that's another big data thing that can help identify those insights, and give us some predictions. And then once we have the list of patients and circumstances that are possibly being predicted, do the small data thing, dive in, okay, and figure out what interventions you need to take for better outcomes for those particular patients. And it's really exciting to me. Um,
Yeah, 'cause
so,
I think that
yeah,
small data, that small
mhm,
data approach is really going to be able to get you to
mhm,
be able to make impactful interventions
yeah,
in an agile and nimble way. Because you're going to be able to get the big trends from big
right,
data. You're going to get
yes,
the big direction of where you want to focus. But
direction,
to
yeah,
actually make an impactful you know make an impactful
right,
um, uh, project or intervention.
right, right,
You're really going to have to get very specific and focused
right, right, right,
on and have a targeted approach.
right. No, totally. I appreciate that. So in terms of what you're doing now, in your career, what's your main focus nowadays? It's been
Well,
some time.
nowadays, most recently,
Yeah.
we did a lot of, speak like trying to fit in small data.
Hmm.
We did a lot uh, of finding best practices,
Yeah.
and
Another buzz phrase. Hmm.
yeah. So and in finding best practices, we would put together various surveys, drawing from the expertise of uh, of our various clients,
Okay.
as well as putting together shared learning sessions. So
Okay.
there's no reason to reinvent the wheel. If
Right.
somebody has something, a solution that seems to be working,
Right.
you want to share that. You want to be able to collaborate and
Oh,
draw
totally.
from other people's experiences. That's an area of utilizing small data for very
Yeah.
specific examples, from very
Yeah.
specific experiences that other people can learn from and
Totally.
improve and spread the best practice.
No, totally. And when I was director of CQI at in a previous life, we used to say, share stories and steal shamelessly,
Yeah.
because if something's working well with one of your peers, take it, replicate it. Why not? Spread it. So if something's working well, just take it on and see how it fits your population and what you're looking at, and use it. Why not? I mean, we're here to learn from each other. So, no, totally.
Yeah, and that's one of the things I really like about working in healthcare. I
Hmm.
think that there's an overall overwhelming uh, a sense of sharing for the greater good.
Right.
There's that idea that like, take for example how polio was cured. That there was a major effort by all the different researchers to pull all
Yeah.
their information together and work towards that one goal. You think about, like, I believe it was the March of Dimes,
Mm.
that was really instrumental in that process. Now, like, people
Right.
don't really people probably don't know what the March of Dimes was for. So
You know what is so interesting that you bring that up, and shout out to Ron Tomo, who is my board chair. He actually is a polio survivor, and he was diagnosed. I mean, he openly talks about this. He's a rock star, and he was diagnosed with polio maybe like a month before the vaccine came out.
Mhm.
as a child. Um, and it's affected him in his life, but you don't see that because he is a rock star and I love him. But it's so interesting that um, you bring that up. But thank you for bringing that up. And perhaps one day in the future, we'll be talking about COVID
Yeah,
and
yeah,
saying, oh, remember that COVID virus? Yeah, it's no longer an issue. You know, we're okay, we're good now, until the next thing comes around, right?
yeah,
And then we use all of these learnings to apply to that next thing. So,
yeah.
you
I
know.
mean, even COVID. I mean, look at
Mhm.
the development of the vaccines.
Mhm.
There was like a lot of collaboration.
Yeah. And you know
Just to
what?
get
I heard that. I think I heard Dr. Fauci say, um, was it Fauci? It was someone else that said they were able to come up with this vaccine so quickly because they really leaned on the trials that they did to find the HIV vaccine. So they did a lot of clinical studies, clinical trials, a lot of research, and the scientists were going to town trying to find, the vaccine for HIV, and they leveraged all of that for the COVID vaccine, and that's why we were able to get to the vaccine so quickly.
yeah,
Um, so, I mean, we learned from previous work, previous trials and errors, and it's a beautiful thing.
yeah, and that's another point of going back, circling
Hmm.
back to shared learning. So
Right.
yeah. So
Shared learning.
that seems to be a frequent topic that comes up in
Uh-huh.
the overarching thing, one of the topics we've been discussing about continuous improvement,
Oh, yeah.
shared learning.
Shared
And
learning.
so I think
Finding, spreading best practices.
yeah.
Yeah, no, totally. And I mean, that's, I'm kind of like doing a little bit of my own with that, with the podcast, because, I'm talking to all of these different folks, and a lot of folks are talking about the same issues,
Mhm.
and tackling it from different angles. And my uh mission here is to bring folks together, to work together, share and learn from one another. And that's why I'm so excited about the podcast and really looking to do more of that because I have connected folks, offline. Um,
Mhm.
but I do want to bring people together and let's have a bunch of roundtables so that others out there in the internet world could listen in and take part in it, you know. Very exciting. So,
Yeah, and I hope this can be used as a tool to back to what my original comment was about
mm,
innovation
yes.
and with small data is about it's more of a mindset,
Hmm.
so being able to be open
Hmm.
to that, uh open to change and
Yeah.
open to creativity and open to thinking bigger and
Yes.
and
Yes.
being able to think fast
Being
and
willing
quick.
to listen,
Yeah,
and yeah, more inclusion and being open to everyone coming to the table.
yeah.
Multidisciplinary. Yeah, totally. So, um, we're almost coming to the end of our talk. And
That went fast.
yeah, I mean, time flies when you're having fun talking about data and reporting and, anything. I always ask my guests, is there like a special call to action that you'd like to share with the listeners? Um, Anything you want to encourage folks to do or encourage folks to look into, do more of?
Oh yeah, yeah. So I recently worked with a lot of like obstetrics
Mhm.
projects,
Okay.
and one of the things that I recently came across was this uh, it's a bipartisan act called the Connected Moms Act.
Oh,
It's
okay.
sponsored by Senator Bill Cassidy from
Mhm.
Louisiana.
Okay.
And really what it's like going back to what we are just talking about, value-based care and innovation, especially with what's happened with COVID and the pandemic and the
Right.
expansion of digital and remote healthcare. The Connected Moms Act is really about,
Hmm.
I think CMS right now is going to be ruling on or making a decision on how to finance it.
Okay.
Really, what it's about is getting uh, various devices and monitors to expectant mothers
Okay.
who may be in underserved or rural communities.
Wow.
So basically to fund various monitors, glucose monitors
Oh,
or
nice. Okay.
fetal monitors. So if I could say have and we're only maybe a couple weeks out from Mother's Day. Um, so I think it's very timely
Oh, yes.
that people should reach out to their local congressman. Look it
Interesting.
up,
Okay.
Connected Mom
Hmm.
Act. Look it
Connected
up.
Moms Act.
Yeah,
Okay.
look it up.
Um,
Reach out to your congressman,
mhm,
local politicians,
mhm.
and say that express your support for it, and try to drive them to support it as well.
Totally,
That would
totally.
be a great thing for for you know moms and
Um,
our
yeah.
community.
Talk about digital transformation, right?
Yeah, exactly.
Um, no, totally. I like this. And speaking of, you know, digital transformation, I know of a number of remote monitoring projects that I've worked on in the past where companies come in to help folks with heart issues. You know, they provide blood pressure machines and heart devices to, you know, I mean, there's some really exciting stuff out there. I'm interviewing another guy who, Brian Stark is his name. He's really involved with tech companies to develop these patches and things that folks wear on their bodies to no longer need to do, I guess, for the diabetics, no longer needing to do the glucose sticks and all of that, the different things that kind of could disrupt the daily life to
Mhm.
try and minimize the burden on patients and get more timely data. So, I mean, there's a give and take with this stuff because it could be intrusive, Big Brother-ish, but I mean, it's you know, it's like they're always watching you. I mean, it's almost like sometimes I've gone past stores and all of a sudden I hear bing on my phone. I'm getting an advertisement for the store that I just walked by. You know, it's scary. But I mean, this digital stuff they're developing in healthcare and the healthcare space is really meant to lessen the burden for patients, get more timely data to the primary care provider, and really close the gaps.
Yeah.
Um, so interesting stuff, and thank you for that. If folks would like to reach out to you, what's the best way to contact you?
They could find me on LinkedIn under Allan R. Morales.
Is
Like,
it the innovator or Alan R. Morales?
yeah,
All right. Well, thank you so much, Alan. I really appreciate it. I appreciate you spending some time with me today to talk about small data and innovation and a bunch of other buzzwords that you brought up. And I look forward to maybe having you back on the show, you
yeah,
know, and
definitely.
one of my roundtables talking about one of these buzzwords or a couple of these buzzwords as we take it to the next level. So loads of fun ahead. So
Yeah, I had a lot of fun.
totally. Enjoy the good weather, and I will see you soon.
All right, take care. Thanks.
Thank you. Thank you. And I am going to say to my listeners, thank you so much for joining me today. I hope you enjoyed hearing more about Alan Morales' work and us talking about innovation in small data. I do hope that you will look into uh, the Connected Moms initiative now being considered and take Alan's call to action seriously. Um, you'll have more information in the notes of this show so you can hear, you know, read more about how to contact Alan and also more about this initiative. To subscribe to the podcast, you can find us on Spotify, iHeartRadio, TuneIn, or you can go to www.eima-inc.com and click on Let's Talk Small Data with T. And that brings us to the end of the program. And I want to say have a wonderful evening. And remember, unleash the power of your small data. It's your most strategic asset. Have a good day. This episode is brought to you by Effective Information Management Systems, specializing in healthcare small data and offering expertise that goes beyond technology. Visit www.eima-inc.com to learn more about MIC.